Hi, I'm Laura Flanders of The Laura Flanders Show. Watch every week on Free Speech TV, Link TV, YouTube, or if you're in New York, CUNY TV. Prefer to listen? Subscribe to the free podcast at lauraflanders.org. I end every week with a commentary. I call it the F word. Here's this week. Transparency, transparency, transparency. The words become a battle cry in Trump times, and there was another skirmish in that battle this week when the administration ordered hospitals to send their COVID-19 data not to the Centers for Disease Control, where it's publicly available, but rather to the Department of Health and Human Services, where the numbers will be stored in a database that's shut to the public. The move sent pundits into paroxysms of outrage. One Esquire writer even called the move crazy evil, nuke the moon to control the tides crazy. But let's spare a little outrage for the data itself. There's still plenty of it out there. As Mary Margaret Phil, medical epidemiologist at Tennessee Department of Health, pointed out, while there is valid concern about data flow, data on COVID hospitalizations and hospital capacity are already being reported and tracked at the state level. So let's look at it. The antidote to darkness isn't shouting at the light switch, it's light. Look at the data and you see that both testing and cases reached record highs in the U.S. this week. And while COVID hoaxers would like to believe otherwise, deaths are also up. But what's truly shocking in the data is the demographic detail. Nationally, Black Americans die at 2.5 times the rate of whites, and in the states seeing rises now, the disparities are especially stark. In Alabama, where African Americans constitute 27% of the population, they account for 45% of deaths. In Georgia, an African American population of 31% accounts for 47% of lives lost. In Missouri, where blacks are just 12% of residents, they're 50% of COVID deaths. And it's not just in the South. In D.C., where 47% of the population is African American, 74% of the dead are black. In Michigan, a black population of 14% accounts for 41% of deaths. Look at the county data, as the volunteer COVID-19 tracking project operated by The Atlantic magazine has, and it's even more horrifying. 5 of the top 5 counties with the highest death rates in the nation are all predominantly black. Transparency is important, especially in matters of public health. We treasure what we measure, and ideologically driven fights over data collection long precede this peculiarly mendacious president. But we can't afford to let our outrage over attacks on transparency distract us from looking at what is still transparent. After the data dashboard wars, we must return to the discussion of white supremacy, the racist reality of who is dying of COVID-19, and the institutionalized bias that reflects is even more of a national shame, or it should be, than that distractor-in-chief, our president.